Good day, folks. Thank you for joining us here at Your Health. On today's program, we'd like to talk about arthritis control the natural way. Glucosamine, chondroitin, and MSM. Do they really work, or is it all a bunch of hype? We will answer those questions today. First, let's go to our news. Let's see what's happening in the health world. New guidelines for the use of MRI contrast agents are now in place. Researchers from Case Western Reserve and the International Society for Magnetic Resonance in Medicine have issued new guidelines for the use of gadolinium-containing contrast material during magnetic resonance imaging studies. Recent research has found gadolinium contrasting agents leave deposits of gadolinium in the brain, particularly with repeated use of these contrast agents. Prior guidelines assumed gadolinium contrast agents were completely removed from the body, therefore, repeated MRI scans with contrast were essentially side effect free. The new MRI guidelines recommend that each MRI study should be evaluated for gadolinium's risk and benefits. The study was published by The Lancet Neurology. Folks, what gadolinium does when injected intravenously during an MRI is it helps to make blood vessels, soft tissues, and tumors stand out much more clearly. This aids in the diagnosis of some of our most common serious health conditions. It also allows doctors to make an accurate diagnosis without performing surgery to visually inspect the body's inner workings. Now, this is a good thing, and it will continue to be a good thing, but for years it had been assumed that these gadolinium-containing contrast agents were completely eliminated from the body, making them relatively side effect free. It has been known all along elemental gadolinium is highly toxic to the brain and other organs. After all, it is a heavy metal. But our contrast agents contain a form of gadolinium that is attached to an organic chelating compound that the body recognizes and eliminates through the kidneys. But in recent months, researchers have discovered gadolinium contrast agents. Once they gain access into the brain, they form deposits, even in healthy brains, and these deposits may stay in the brain for years on end, causing brain damage. So that's the background to this new guideline issuance. Now we are urged to evaluate each and every scan on its individual merits of risk and benefit. Normally, this would be a doctor issue solely, but many lay people seek out MRI as a feature of an executive physical. Using gadolinium contrast in this setting when disease is not suspected, but rather used to confirm good health, well, it's just not a good idea. On the other hand, if serious disease is suspected, have the scan with gadolinium, but don't repeat the scan over and over just out of curiosity. It is also worth mentioning that all medicines have side effects, even if the experts say they don't. Excessive job stress leads to junk food consumption. Researchers from Michigan State University evaluated 235 subjects for their job stress and eating habits. They found as stress increased, so did the consumption of junk and fast foods. They also found as job stress increased, so did the likelihood of the worker developing a chronically bad mood. The researchers found if a worker experienced stress on the job, yet they were able to get a good night's sleep, they were much less likely to eat junk food the next day. This study was published by the Journal of Applied Psychology. Related research from Ohio State University finds from a study of over 8,000 people of all segments of American society, rich and poor, consume fast food on a regular basis. In fact, middle-income Americans eat the most fast food. The study was published by Economics and Human Biology. And finally, from Tufts University, since the consumption of corn syrup and sugar-sweetened beverages is associated with weight gain and health decline, nutrition and public policy experts predict the implementation of local taxes on sugar-sweetened beverages will spread. Experts hope taxing sweeteners will discourage their use. The study was published by Food Policy. Well, folks, as if we do not have enough stress to deal with, now the politicians want to tax sugar and high fructose sweetened beverages on a widespread basis. Several large municipalities have proposed such taxes, and a few have implemented them. There is no doubt that we're still consuming too much sugar, but I seriously doubt the politicians have our well-being in mind when they want to tax foods, but rather They're simply looking for new sources of revenue. And I truly hope it doesn't come to that. Also, more taxes lead to more stress, which, as we learn, will lead to more junk food consumption. And past research has suggested that a sugar tax could paradoxically lead to more sugar consumption. You know, it's the forbidden fruit concept. In any event, according to our first study, the best remedy for a stressful job is a good night's sleep, as sleep greatly reduces the desire to reward ourselves with junk food after a difficult day at work. Also, I might add from other research, a little exercise after a stressful day does wonders for both sleep and appetite control. And by the way, we learn all segments of society consume fast food, especially middle-income Americans, so it is true, America's dietary patterns are everyone's concern. Well, today on Your Health, we'd like to discuss arthritis control the natural way. Stay tuned, we'll be right back. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
BioInnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the auto ship program for additional savings.
I'm Cindy Becker, and this is Your Health at a Glance. Do you want to maintain your mental clarity? With people living longer, we need more research into the ways to lower the risk of dementia. Studies are showing us that people who regularly read books, complete puzzles, or solve word games like the Sunday crossword puzzle maintain their mental abilities longer than people who don't. We also preserve memory by maintaining social activities, such as volunteering, attending religious services, or regularly talking with friends and neighbors. And diet plays a big role as well. It's important to eat a nutritious diet free from heavy metals and chemical pollutants, and full of vitamins and the essential fatty acids which power the brain. These simple and important steps will help keep you mentally healthy for many years to come. For Your Health at a Glance, I'm Cindy Becker.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the auto ship program for additional savings. That number's 888-442-2128.
Welcome back, everyone. It's such a great blessing to be with you today. We're going to have a great time together. We're going to learn about how we can handle joint pain. We're going to learn how an amazing substance from nature, glucosamine, chondroitin, and MSM, can help support naturally healthy joints. Richard, this is a big one. And you know, arthritis has got to be up there with one of the most common reasons someone sees the doctor.
Yes, it is, and it's the most common reason to be disabled. Pain and joint dysfunction and arthritis. Arthritis causes joint inflammation resulting in swelling of the joint, pain, restriction of motion, joint space narrowing, even deformity of the joint, and of course disability. Plus, it just hurts. you know, and it's relentless. It goes on and on and on. The most common forms of arthritis are osteoarthritis, rheumatoid arthritis, and gout. There are many types of autoimmune arthritis, and they have their unique features, but far and away the most common is osteoarthritis, rheumatoid, and followed by gout. It's estimated over 70 million Americans, probably around 75 million now, have arthritis. 50 million of these have doctor-diagnosed arthritis, and over 20 million live with chronic joint pain, and they've just not been diagnosed. The vast majority of these, of course, have osteoarthritis. Baby boomers, people born from 1946 to 1965, are now at prime risk for osteoarthritis. However, younger folks, don't think you have to be old to get osteoarthritis, because over half of those with osteoarthritis are under 65. It can start at a very young age, especially if you've had trauma to your joints. I'm thinking of athletes, you know, high school football players. We've all heard that story. I hurt my knee in high school. I began to have pain at around 35, and I've had it ever since. It's a very common story. Injury can initiate osteoarthritis. Half of the Americans with arthritis think that there's nothing that can be done to help them. Half. You know, I find that interesting. 40% don't even tell their doctor they're hurting. They just suffer in silence. And I think part of that is many people don't want to become dependent on medicines, and I appreciate that. Others, the side effects of medicines are prohibitive. So many people with osteoarthritis aren't even aware that there are natural measures that you can do that will help your pain, and you don't even have to take a pill ever. I mean, a medicine pill. You never have to take that medicine. Medicines for osteoarthritis, they calm the inflammation and they help with the pain, and there's a place for them. But they do not improve joint health. In fact, over time, if you take non-steroidal anti-inflammatory medicines on a daily basis for prolonged periods of time, it actually can erode your joints, erode your bone strength, cause great damage to your stomach, liver, and kidneys. The non-steroidal anti-inflammatory drugs most commonly prescribed to control the pain of arthritis are the most commonly prescribed medicines in the world, and they are also among the medicine group that cause the most trouble. Non-steroidal anti-inflammatory drugs are well known for their side effects, and there's a point where you just can't take them anymore. Now, I'm not saying you should never take ibuprofen or some of the other naproxen. I'm not saying you should never take those. I want you to have your pain relief, but if you find you're taking ibuprofen or something like that every day for your joint pains, please explore alternatives. So if you're on something else, you know, a natural supplement like we're going to talk about today, and then on a bad day, you can have the medicine for more relief if you need it, but you're not dependent on the medicine every day. You're going to have a better life if we can approach it that way. Does that make sense, Cindy? Because we're not about telling you to never take medicine. That's not the world I live in. That's not practical. We need our medicines, but we need to know more about our alternatives to medicines. Then we have a better palette to paint from, a better toolkit to deal with the problems of life. Well, let's talk about this stuff, glucosamine, chondroitin, and MSM. There's been quite a bit of controversy about glucosamine. Does it really work? Two often cited studies say that glucosamine and chondroitin are not effective in treating osteoarthritis, and that glucosamine is damaging to the pancreas, and that glucosamine can raise your blood sugar levels and it's more trouble than it's worth. All of that is not true. I want to dispel that right away. The osteoarthritis market is a $120 billion a year market, and the drug companies don't want any competition. You know how money works. You know how business works. They control the airways with advertising, so they're going to discredit any popular alternative therapies. And glucosamine and chondroitin account for about $2 to $3 billion in sales every year, and they don't want that to become 10, 30, 40, 50, so they create studies, they design studies to discredit glucosamine, chondroitin, and MSM's effect. If you read the science, if you study the science, if you treat sick people and people in pain, you soon learn that glucosamine chondroitin, and MSM do work, and the studies prove it. Now, one of the problems that people find with glucosamine is the studies designed to discredit glucosamine rely on non-crystalline glucosamine. Let me explain. For a chemical compound to crystallize, it requires that compound to be pure. It cannot have contaminants. Crystallizing compounds, it implies purity and single agents, so that agent is not attached to anything. And that is everything in glucosamine, because this individual unit, glucosamine, must be absorbed into the system and incorporated into our integument. Integument meaning, well, the chemical name is glycosaminoglycans. This is what holds us together. It's like the batting in material. It's the framework. It's the weave of our body. It's our connective tissues are made of this substance, and it permeates in our entire being, and it's highly concentrated in our bones and joints. And if we don't have enough glucosamine, chondroitin in our systems and sulfur, we become weak, and our joints become more prone to decay and osteoarthritis. Impure glucosamine, non-crystalline glucosamine, doesn't go through that process very well. And so if I wanted to discredit glucosamine, I would design a study where we're not using good stuff. That makes sense, and that's exactly what they do. If you look at the studies using crystalline glucosamine, it works beautifully for osteoarthritis. Problem solved. We use crystalline glucosamine for our arthritis needs. We have over 14,000 double-blind studies on glucosamine, about the same number on chondroitin, about 800 double-blind studies on MSM. These are hundreds and hundreds of preponderance of evidence. When you use pure stuff, it works. And why would we want contaminants in there anyway? What's the point of all that? We need to purify our intake and not ingest quite so many contaminants. We all realize the world's a polluted place, and we need to take steps. And it's no different in our dietary supplements. Thousands of scientific writings clarify the exact mechanism and safety profile. We've reviewed the literature for you. Glucosamine, chondroitin, and MSM are highly effective treatments that calm the inflammation, reduce the pain, help to maintain the strength integrity of the joint. They provide the basic ingredients for connective tissues so that they can be rebuilt. You know, we are in a constant state of breaking down and renewal. Enzymes to build us up, enzymes to break us down. And in osteoarthritis, one of the phenomena is the mechanism to break us down is over-amplified. The mechanism to build us up is under-amplified, so we become in a state of decay. This is the essence of mortal life, is it not? Glucosamine, chondroitin, and MSM, as we will find from our scientific study today, helps to build up the process that restores the joint. It slows and even stops the osteoarthritic decay process that leads to these terrible joint pains that keep you awake at night. Now, let's go to our break. When we return, we'll review the science, the specific science on glucosamine. We'll be right back.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastro defense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128. I'm
Dr. Richard Becker for Your Health at a Glance. More more and more people suffer from asthma, one cause is obvious. The world is a polluted place, and the air we breathe is not always healthy. But other causes of asthma aren't as obvious. Recent research connects a poor quality, high sugar diet and the frequent use of antibiotics to higher rates of asthma and cases of asthma that are tougher to treat. A fast food diet does not meet our nutritional needs. Plus, the indiscriminate use of antibiotics can seriously disturb the delicate balance of healthy microbes in our intestinal tract. So switch to a garden fresh diet that calms and prevents asthma. Eat fruit-like veggies such as tomatoes, cucumbers, and eggplant. Eat yogurt, ginger, turmeric, and take fish oil. Nature holds the answer, but it's up to us to make healthy choices. For your health at a glance, I'm Dr. Richard Becker. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why BioInnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings. We're back, everyone. If you're just joining us, we're having a great discussion today on how you can naturally support healthy joints with glucosamine, chondroitin, and MSM. So, Richard, you have some research now to go through on glucosamine.
Yes, let's talk about this, understand it a little better so we can use it better in our daily lives. Glucosamine is a natural form of an amino sugar. An amino acid, an amine group, is attached to glucose, and it plays a role in cartilage formation, connective tissue formation, and repair. And one of the criticisms we've heard on glucosamine is that it raises your blood sugar. That doesn't happen. That study was a test tube study. And when you put it into enzymes in a certain type of environment, it can release the glucose from that glucosamine, but that's not what our body does. It's that special amine group, while attached to the glucose, that allows it to become a chain of strength in your tissues. And if our body were to break that apart, we'd just burn up the glucose and the amine as an energy. It doesn't do that. Further, to raise your blood sugar from glucosamine, you would have to take lots of it. We're taking 1 gram to 1.5 grams a day. That would be equal to about 1/4 to 1/5 of a teaspoon of glucose. How much is that even going to raise your blood sugar? It's not going to. And studies have discredited that. So you can ignore that. It doesn't raise the glucose levels. It protects the joint surface. It creates an outer, tough environment, a protective outer environment of the joint surface that resists wear and tear. It helps to restore the structure and function of the cartilage of joints. You know, folks, I often think when I'm studying and preparing for this, I think of my dogs. Cindy and I have always had dogs all the time, and we love our animals. And have you ever noticed how dogs love to chew on bones? Why is that? They want the glucosamine, they want the chondroitin, the connective tissue components found in the bone, in the joint surface. They want that in their diet. Well, we humans don't chew bones, do we? I mean, that's just not something we do. But we still need those nutrients in our diet. Taking the supplement is a good way to get that so you don't have to chew the bone. Does that make sense? It does to me. It helps to restore the structure and function of the cartilage in the joint. And the scientists know what else it does. It calms inflammation. This is a major reason why glucosamine helps people with arthritis. It reduces interleukin-1. These are cytokines. These are inflammatory promoting molecules that the body releases when we have arthritis. and it reduces the gene expression of that. So not only does it counter the molecule, but it decreases the amount of interleukin-1, the inflammatory junk that our body makes when we have arthritis. It also affects the cytokine intracellular signaling cascade. This is how the cells communicate in response to wear, tear, stress, and inflammation. It helps to calm that down, and it inhibits factor kappa beta. This is all scientific stuff that you don't need to know, but the point of it is researchers know. We know how it works. It's not a mysterious element that is prone to side effects because we know the mechanism. And that's important. We're going to ingest this in our body. We need to know how it works, and they know how it works. Anti-inflammatory properties, it reduces the inflammation of arthritis between 20 and 30%. And that is a nice, calm anti-inflammatory. If we did it 100%, it would lead to disease very quickly because a little inflammation leads to repair and restoration. So we don't want to completely eliminate inflammation. It's a normal part of us. We want to just control it. And glucosamine reduces that from 20 to 30%. It has antioxidant abilities. It counters the free radicals that lead to pain. Part of the pain of osteoarthritis is the free radical release by damaged cells and damaged cell membranes. It leads to the pain of osteoarthritis, and we can counter that, and that makes a difference. It also slows and stops the degeneration process of osteoarthritis, and that is impressive. So the drugs, they just stop the pain. They do nothing to build the body up. Glucosamine and chondroitin have been proven over and over to slow the decay and even stall it in long term where it doesn't progress anymore. You have to keep it up. It's not something that is curative with a week's worth. It's something you have to continue with. But until we find a true cure for osteoarthritis, this is pretty good. This is pretty good stuff. A review of the literature shows crystalline glucosamine works. The other kinds don't. Purity and absorbability matter. If we take long chains of glucosamine, when it's not broken into the individual units will crystallize, the long chains don't. That's the whole point of this. If we take the long chains of glucosamine, it doesn't absorb very well. We have a problem. That bond, glucose to the amine, doesn't really break loose with the acid of the stomach. And if it's not prepared properly into the crystalline form, we're not absorbing it. Now, there's one thing you need to know. Glucosamine is extracted from shellfish. Shellfish. Crab, lobster, shrimp. If you are allergic to shellfish, you better not take glucosamine. Now, the extraction process, we're getting purer and better all the time with it, and some people with mild allergy may be able to take it, but you better know what you're doing because you can get into a lot of trouble. You can be desensitized to these types of agents if you're allergic, but again, you better know what you're doing. You need the help of a doctor to do that. So for our purposes today, if you are allergic to shellfish, glucosamine is off your list. Make sense? That's important. I don't want anybody having troubles because of my words. I want to be very clear about that. Glucosamine is extracted from shellfish. Now, some specific studies. Monash University in Australia, 12-week study, 46 people with knee pain, 88% of the glucosamine group, the knee pain improved compared to only 17% in the placebo. That was in the British Journal of Sports Medicine. Long-term study of 212 patients, 50 years and older, who received 1,500 milligrams of glucosamine alone, just glucosamine. It halted progression of joint damage, and they did x-rays to assay that, and reduced the symptoms of osteoarthritis. 2 3-year studies, double-blind, placebo-controlled, involving over 400 subjects. Those who took glucosamine, single-agent glucosamine, no further joint space narrowing. If you are bone on bone in that knee, it's not going to be enough. I'm going to tell you that right now. Bone on bone, you need a knee replacement. But if you still have a cushion of cartilage in the knee, with time, we can build that up to make a difference, improve your pain and improve your function. Glucosamine inhibits cartilage, cartilage protective effects on joints. And glucosamine with potassium, you will often see glucosamine. See, it has to be in a salt. We're back to the chemistry. And that dissolves and allows it to be absorbed. You can find it in sodium, glucosamine sodium, that form of the salt, or glucosamine potassium, glucosamine with potassium. Now, do we not get enough salt in our diets already? Do we need to add sodium to our dietary supplements? I don't think so. So we have selected the glucosamine with potassium. We need more potassium. People who have more potassium in their diet have fewer fatal heart attacks, fewer strokes, less blood pressure problems, and on and on. Potassium is a good thing. It is health promoting. So let's attach it to glucosamine. Now we have a win-win, see? So when you know the science, you can make a big difference. When we return, let's review the science on chondroitin. We'll be right back. Have you heard about the health-promoting power of medicinal mushrooms? These remarkable mushrooms include maitake, shiitake, reishi, and ABM. The medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems.
BioInnovations brings you Dr. Becker's Bionutrients Mushroom Complex with maitake, shiitake, reishi, and ABM in one convenient product.
Our mushroom complex features the safest and most powerful medicinal mushrooms available, providing natural support for a variety of health conditions.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Ask about the AutoShip program for additional savings.
I'm Dr. Richard Becker for Your Health at a Glance. Are you one of the 25 million Americans who suffer from an autoimmune disease such as rheumatoid arthritis or lupus? Autoimmune diseases are caused by a misdirected immune system that attacks the patient as though their own cells are a foreign invader. You can manage the symptoms of an autoimmune disease by living a healthy lifestyle. Here's a strategy. Avoid unnecessary exposure to pollutants and chemicals. Eat a simple organic-based diet free of junk food, low in sugar and food additives. Avoid foods that seem to cause flare-ups of your disease, and stay active and exercise. Scientific research shows natural agents are of great benefit to the autoimmune disease patient. Yogurt helps to maintain normal bowel flora. Fish and flaxseed oil and noni juice calm inflammation. Vitamins and minerals provide nutrients for proper immune function. Keep fighting and don't ever give up. A positive attitude can make each day a little better. Is your life out of balance? It may be. The average American consumes far too many omega-6s and not enough omega-3s. This creates an imbalance.
So what can we do to get back in balance? We can eat a healthy diet.
And most of us need to supplement with omega-3 rich fish oil. Fish oil contains omega-3s with DHA and EPA, fatty acids that promote good brain and heart health. So reduce omega-6 in your nutritional plan and boost omega-3 to get back in balance.
To help you do that, BioInnovations offers two products, the Fish Oil Complex and Omega 369, both formulated for your health and well-being. So how do you choose? For highest levels of DHA and EPA, choose the Fish Oil Complex. For a balanced formula, choose the 369.
Go online at bioinnovations.net or call 888-442-2128. Ask about the AutoShip program for additional savings.
We're back, everyone, talking about glucosamine, chondroitin, and MSM. And to help you get the product that you need, we have a great special today on this. We have the Dr. Becker's Bionutrients, glucosamine, chondroitin. We just call it GCM. Too much words right in there, right?
We do.
Anyway, glucosamine, chondroitin, MSM. Buy one at the regular price, and you're going to get a second bottle free. That's a great one, so don't miss that one. So, Richard, it's best to take this with food, right?
It is. Almost all of our dietary supplements
and
should
then
be
almost
taken with food.
everyone, there's really no side effect to when you ingest it.
No, it's pretty well
it's really
tolerated.
Easy. Yeah.
We hardly ever hear of anybody saying, you know, it's possible if you take a lot of it, I guess
I
you
think
could
the
get
shellfish
queasy.
thing is really the only
Yes,
thing.
that's the thing. And, you know, people don't like taking a lot of pills. I understand that. But sometimes you have to take a few of these pills to get the effect.
Right.
Let's talk about chondroitin a little bit. This is a large alternating carbohydrate chain. It's a unique chain, and it's attached to a small protein that gives cartilage its elasticity. When it's absorbed, the body attaches it and lays it down into the joint and other connective tissues. Remember, this type of tissue permeates our entire body, this type of molecule, these connective tissues. And it gives the cartilage elasticity. So glucosamine gives a strong exterior to the cartilage, and chondroitin gives elasticity. So it's a cushion effect. Strength on the outer surface and a good cushion, like a pillow, so the joint can absorb the shock. That's the whole point of this cartilage, and to lubricate and give a good slip in the joint so there's less friction, less wear and tear. And chondroitin provides that aspect of it. Chondroitin is of bovine origin, cow, cattle, beef. If you're okay with that, then chondroitin is on your list of okays. Chondroitin is naturally found in our bodies, so this is not a foreign drug in any way. Glucosamine is also natural to our bodies, if that helps you visualize and understand. It's naturally found, the chondroitin, in our cartilage, in our bone, in our cornea, skin, arterial walls, throughout the human body. It helps to hold us together. It promotes water retention. It creates a cushion effect. It's a compound that blocks enzymes that destroys cartilage. We talked about that, building up, tearing down, constant state of renewal. And chondroitin also promotes the buildup of these tissues to give us good strength. Studies have shown that chondroitin increases joint mobility, and it also slows cartilage loss. It protects the inside of the cartilage. So if the hip is arthritic, the knee is arthritic, and oh, you just can't bend it all the way, and it, you know how it goes. With time, you will begin to gain a little more mobility, and then you can exercise a little more, because we know exercise helps arthritis. It's counterintuitive. A joint that hurts from arthritis, most people, well, I need to sit, I need to rest it. Well, no, with arthritis, activity improves the symptoms of osteoarthritis. I didn't say running marathons. You don't have to do that. Don't think you have to do that. But stay active. You will feel better if you do, and it improves. It keeps the blood flowing. It clears out the toxins, and it promotes repair. All right. The effect of chondroitin lasts longer than the nonsteroidal anti-inflammatories and other drugs. 1,200 milligrams a day is a recommended dose in divided doses, and it's the same dose for glucosamine. 1,500 a day for each is the study dose that provides the best results. After 2 grams a day of glucosamine or chondroitin, we don't get much benefit back. So if you're a very large person, you could increase the dose, but for most of us, 1,500 milligrams of glucosamine and 1,500 milligrams of chondroitin in divided doses, or you can do it all at once over time. It's very similar effect. Chondroitin improves function and decreases pain in osteoarthritis of the hands. That's been proven in multiple studies now. 120 osteoarthritis subjects, double-blind, placebo-controlled, with just chondroitin sulfate, just chondroitin. Decreases pain and improves joint function while stopping disease progression. 6 months of chondroitin reduced cartilage volume loss. 12 months reduced bone marrow lesions. That study is in the Annals of Rheumatoid Disease. Now, when we have severe and advanced osteoarthritis, you can see on X-ray lytic lesions of the bone. It's not just the joint. Inside of the bone, you see evidence, and the bone begins to weaken, and it's probably a result of the inflammatory process. And you can actually see it on X-rays. And if you put pressure, the examining hand on the patient, you put pressure on that spot, they jump. It's painful. They do not like it, but it confirms the diagnosis. So we see over time those lytic lesions associated with osteoarthritis of the bones around those painful joints, they begin to calm down, and they begin to resolve. Isn't that amazing? No drug known to date can do that. If you know of one, let me know, because the world needs to know about it. Tell me about it. But to my knowledge, in all my studies, I've never found a drug who does that. Now, steroids will calm it down. you may be able to turn the tide a little with a steroid, but you don't want to take steroids every day for osteoarthritis. You will be in a world of hurt before you know it. Please trust me on that one. What else? University of Washington, chondroitin alone outperforms fish oil or glucosamine for lowering full body inflammation. So combine it with those agents. Now you really get a good anti-inflammatory effect, drug-free. Chondroitin improves knee pain and plaque formation in psoriasis patients. Remember, this goes throughout the body, connective tissues, and in psoriasis, we're turning over skin cells very quickly, and it has a very increased demand for connective tissues of the skin. And with psoriasis, chondroitin even improves the plaque formation, what you see with psoriasis on the skin. It even improves that. Now, when we return, let's talk about the advantages and what the science says when we combined glucosamine, chondroitin, and then add the MSM all together. That's how we do holistic care for better joint health. We'll be back. For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-2128. Ask about the AutoShip program for additional savings. Call today.
Here is our hope for you today. I'm Cindy Becker. In the epic movie Gone with the Wind, Scarlett O'Hara says she won't think about her problems today or she'll go crazy. She'll think about them tomorrow. How should we think about tomorrow in our lives? In Matthew 6, verse 33, we get advice about tomorrow. Seek first his kingdom and his righteousness, and all these things will be given to you as well. Therefore, do not worry about tomorrow, for tomorrow will worry about itself. It's so difficult to not worry about the future. Many of us catastrophize about the future. That's spending all your time thinking about all the catastrophes that might happen. So let tomorrow worry about itself. That way, we won't miss the wonderful things happening in our lives right now. I'm Cindy Becker. This is our hope for you today.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
BioInnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net.
We're back, everyone. Just a little reminder about that special today. A great way for you to get the glucosamine, chondroitin, and MSM in your diet is to supplement. So our special today is you buy one bottle at the regular price. You're going to get a second bottle free. That's today only, so don't miss it. So Richard, now we've been talking about chondroitin.
Yes.
Now we're going to talk about the benefits of combining chondroitin with glucosamine.
Yes, you know, you don't know something till you study it thoroughly. Just because one thing does something and the other thing does the same thing, doesn't mean the two together, you would think it was, and usually it would, but not always, and so we have to study that as well. Belgian University, glucosamine and chondroitin, when combined for osteoarthritis, it delays the progression in the lower limbs. And the knee is the most commonly studied joint for the benefits of treating osteoarthritis. But other studies have confirmed, whether it's the shoulder, the elbow, the wrist, wherever this osteoarthritis is, we get benefits. It's not just the knee joint. University of Southern California, they determined that when we combine glucosamine with chondroitin, it favorably maintains the balance of cartilage, matrix synthesis, and degradation. That's the process of building up and tearing down. It promotes the building up when we combine the two together. Multiple reviews of all the available literature involving well over 40 studies now, preponderance of evidence, confirms combining glucosamine with chondroitin relieves arthritis pain while improving joint function and preserving joint structure. That's all we're looking for. It does require ongoing maintenance therapy. You have to keep taking these agents. They work in concert. Now, there's one final component to this puzzle of how do we better relieve naturally osteoarthritis pain, and that is an organic source of sulfur. You know, in our connective tissues, we have sulfur-based cross-links of our collagen that hold everything together. When collagen is just a straight line of chains, it's not very strong because it can split apart lengthwise. But when we cross-link the chains of collagen, it becomes strong to stress and tensions from all directions. And sulfur is incorporated into amino acids that help to provide this. Plus, sulfur does a wide variety of things in the body. It's essential. We have to have it in our body or we will not live. And you know, I think we've all heard of old-time remedies. It's a source of sulfur. It'll help your aching joints. Well, that's what got the attention of scientists and doctors alike. And so they've studied organic source. See, plain sulfur is inorganic. If you just go to a sulfur mine and ingest sulfur from the earth, you're not going to get the benefit. In fact, it's toxic. It turns to sulfuric acid when it hits water. It's not a good thing. So attaching this sulfur, not sulfa, sulfur to an organic molecule allows our body to recognize it and use it for its various needs. Make sense? What does it do? It maintains strong connective tissue. It relieves pain and inflammation. It modulates the immune system in autoimmune diseases. MSM, methylsulfonylmethane. That's the organic source of sulfur. It helps to repair damaged muscles. It improves sleep, especially in those with arthritis. And it's something to behold. You take the organic sulfur source, and it's like, I can sleep. It's restful sleep, and it eases into sleep. And you know, if you can get your sleep, you can deal with a lot more trouble in your life. Have you not found that to be true? But when the pain keeps you awake at night, oh, you just can't get comfortable. The next day, you're off your mark, you don't feel well, you're tired all day, then you can't sleep at night again. This is the cycle we have to break. It makes a huge difference in controlling ongoing chronic pain when we can sleep better. And MSM has been shown to improve sleep quality. Boy, that's a good thing, very good thing. The typical dose is 1 to 3 grams a day. This form of sulfur you can take if you're allergic to shellfish. Here's a study, 50 subjects with osteoarthritis, double-blind, placebo-controlled. They just used MSM, methylsulfonylmethane. It improves the symptoms of pain and physical dysfunction with no significant side effect. Medical College in India, Kasturba Medical College, 12 weeks, 40% reduction of pain, just from MSM. 28% improved mobility, 75% reduction in pain medication use just from MSM. A review of 20 studies from around the world, MSM works. And when you combine it with glucosamine chondroitin and have that GCM combination that Cindy refers to it as, you get remarkable relief with time from your osteoarthritis. Now, this combination is everything. Let's go to our break, and when we return, I want to explain how to take glucosamine, chondroitin, and MSM. And if we have the time, I'd like to mention some of the other holistic measures that will give you a complete package to address this arthritis that's really got you down. We'll be right back.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings.
I'm Cindy Becker for Your Health at a Glance. Each year, more than 76 million Americans contract food poisoning. Most cases are caused by tainted fruits and vegetables, especially contaminated leafy lettuce. But poultry causes the most food poisoning-related deaths. To prevent food poisoning, follow these simple rules. Thoroughly wash all fruits and vegetables. When preparing any kind of meat, wash your hands, utensils, and work area before preparing any other food. Cook thoroughly chicken and ground meats. Store leftovers in the refrigerator immediately. Look for expiration dates when you shop. If you use reusable grocery totes, wash them periodically. And finally, use spices such as garlic and oregano to inhibit the growth of bacteria that cause food poisoning. Food safety lowers your risk significantly of getting sick. For Your Health at a Glance, I'm Cindy Becker.
CoQ10 and L-carnitine are among the most important nutrients our bodies use for energy production. Deficiency in these key nutrients can cause serious complications to your health. In fact, statin drugs that are used to lower cholesterol may deplete your CoQ10 levels.
BioInnovations brings you Dr. Becker's Bionutrients CoQ10 with L-carnitine. Now, providing support for cardiovascular health is easier than ever before.
CoQ10 and L-carnitine support a healthy heart naturally, as nature intended, and our formulation provides 300% greater absorption of CoQ10 than similar products, using a technology so effective it's patented.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. Just a quick reminder, we have that fantastic special for you today on the glucosamine, chondroitin, and MSM. We have Dr. Becker's Bionutrients, glucosamine, chondroitin, MSM at buy one, get one free, so don't miss it. So, Richard, let's talk about the best way to supplement with glucosamine, chondroitin, MSM.
Well, each capsule, and we designed this with capsule for good absorbability, release of the nutrients. Each capsule contains glucosamine 375, chondroitin 300, and MSM 375 milligrams. So to get you the 1500, 1500, and 1200 milligrams, 4 capsules a day will give you the 1500 milligrams of glucosamine, 1,200 milligrams of chondroitin, and 1,500 milligrams of MSM. Statistically, that helps the most people. You don't need to take more than that. Unless you're a very large person, then you might need to take more than that. Like almost all of our other dietary supplements, with food and a good big glass of water, that's the best way to do it. Now, in the vein of complete holistic care, I want to quickly mention some other dietary supplements and measures you can take that will help you with your pain of arthritis. Fish oil. Fish oil is huge in this area. It calms inflammation, reduces the number of swollen and painful joints. Multiple studies have shown that. Noni juice. Noni is just outstanding for anything painful. It is a calm inhibitor of the COX-1 and 2 enzymes. It blocks the transmission of pain up the spinal cord like a narcotic, but without narcotic problems. No dependency, no stimulants, none of that won't interfere with your sleep like narcotic pain relievers can do. Noni juice is a great complement. And I might add, it is imperative if there is any infection anywhere in your body, you're not going to get good pain relief from your arthritis till that infection's under control. And the most common place for these chronic smoldering infections are the teeth, the respiratory tract, you know, like chronic bronchitis, that type of thing, or intestinal dysbiosis, altered bowel flora far and away, and particularly yeast. If you have an ongoing yeast infection, your joints are gonna hurt. Get that under control and you're going to get better control of your arthritis. Then these other measures really make a big difference. I want to emphasize the importance of getting chronic infections, whether you realize you have them or not, under control to control your arthritis pain. Have I done that, Cindy? Because it is imperative. All right, I've said enough on that. Vitamin D. People with low vitamin D levels are in chronic pain. Multiple studies have proven this. If you're hurting day after day, you're probably very low in vitamin D. Boswellia, the biblical spice frankincense, is wonderful for chronic inflammation and arthritic pain. Curcumin, we've talked about that in many shows. Royal jelly, that's a really good agent to calm pain and to help you fight infections. Cherry fruit extract, particularly helpful for gout, cherry fruit. The B vitamins, vitamin C, and a quality multiple vitamin and mineral. Many people in chronic pain are in delayed, stalled healing because they are malnourished. They don't have the nutrients. Zinc comes to mind. To heal properly, so they're constantly inflamed. Remember, inflammation is part of the healing process. It triggers healing. But it gets out of hand and the inflammation goes on and on because we're malnourished and we're not healing. What else? Topical and systemic magnesium. pH correction. Is your acid base off? Are you drinking enough water to maintain the proper pH of your bloodstream? If your pH is off, things hurt. Things hurt. Hyaluronic acid plays a role in joint management. Hydration, we mentioned that as a source. Chronic infections, not getting enough exercise, poor sleep, all of these play a role. Today our topic is glucosamine, chondroitin, and MSM, understanding it better and how it calms inflammation and helps to build the integrity of the joints. Well, folks, crystalline glucosamine, chondroitin, and MSM are effective and safe measures to help relieve your osteoarthritis pain. Study after study confirm these agents help to protect the joints from free radical damage while they calm inflammation, and they help to slow and, in some cases, even stop the progression of the degenerative process that's causing your pain. Almost anyone can take advantage of these agents. Careful with shellfish allergy, better not there. Give your plan 3 months. It takes time to rebuild joints, but you're going to see a difference. Well, folks, don't live life in pain. We can take steps to make you feel better. Thank you for your kind attention. We'll see you tomorrow right here in Your Health.
Thanks, everyone. We'll see you tomorrow. Bye-bye.